Hello everyone, welcome to Alacrity Explains Medicine. Today we're going to be looking at adverse drug reactions in pharmacology. So adverse drug reaction is a harmful, unintended and undesired response to a drug that occurs at normal doses used in humans for the prevention, diagnosis or treatment of disease or for modification of physiological function. Now, adverse drug reactions are a major cause of morbidity, mortality, and prolonged hospitalization, as well as increased healthcare costs. It should be distinguished from drug overdose, drug abuse, or medication error. Adverse drug reaction is not the same as drug overdose, nor is it the same as drug abuse or medication error. Characteristics of adverse drug reactions: it usually occur at therapeutic doses. That means it's given within the therapeutic range. It may be predictable or unpredictable. Like you know that when you take antihistamines, specifically first generation antihistamines, you have sedation. That's a predictable adverse drug reaction. It may be mild, moderate, or severe. It will also be life-threatening. It can occur immediately or after a prolonged drug use. Some adverse drug reactions disappear after stopping the drug, while others may be permanent. Now let's classify adverse drug reactions. Adverse drug reactions are classified into type A, type B, type C, type D, type E, type F. So for type A adverse drug reaction, the A is also called the augmented reactions. It's the most common type, about 80% of adverse drug reaction. It is related to the known pharmacological action of a drug. It is related to the known action of that drug. That means it is predictable, it is dose dependent, and usually preventable by adjusting the dose. There is low mortality because it is predictable, so there's low mortality and it's easily preventable by adjusting the dose. Causes of augmented adverse drug reaction: we have excessive pharmacological effect, drug interactions. Maybe there's a drug that's inhibiting the drug or inducing enzymes, inhibiting enzymes that metabolize this drug. There's reduced drug elimination is another factor, and high drug concentration. Examples of augmented adverse drug reactions: we have hypoglycemia in insulin. From insulin, you know that when you give insulin is a drug given to decrease or to treat diabetes mellitus, that is to decrease blood glucose level. So in infusion of insulin, it can cause hypoglycemia. So this is predictable based on the known pharmacological action of this drug. Now, bleeding in warfarin is another example. Hypotension in antihypertensive drugs is also another good example. Type B, we have the bizarre reactions, which is uncommon. It is unpredictable, unlike the augmented. It is uncommon, it is unpredictable, it is not related to the normal pharmacological action of the drug. It is not dose dependent. It is often severe, from the name bizarre. It frequently it is immune mediated or genetically determined. Example, penicillin anaphylaxis in penicillin. Intake of penicillin, this is not common in everybody. That's why we say it could be genetically determined. Stevens-Johnson syndrome from the use of sulfonamide. Hemolysis with primaquine in G6PD deficiency individuals. Malignant hyperemia with certain anesthetic agents. We now have type C reactions, which are chronic. That's chronic. It is often after a prolonged drug use. In this case, type A, we say it is augmented, which is predictable. Type B, we say it is bizarre, which is non-predictable. Type C, we say it is chronic, and which is after a prolonged drug use. It is related to cumulative dose and duration of therapy. For example, adrenal suppression after long-term use of what? Corticosteroids. We have tardive dyskinesia from prolonged antipsychotic therapy. We have analgesic nephropathy from chronic analgesic use. We have type D reactions, which D represent delayed. It's a delayed reaction. It is after the adverse reaction appears long after exposure to such a drug. It may occur months or years later after the use of that drug. And examples is carcinogenesis, some anti-cancer drugs, teratogenicity due to drug exposure during pregnancy. There are some drugs that are teratogenic. We also have secondary malignancies after chemotherapy. We have the type E, which is end of use reactions that occurs after a sudden withdrawal of a drug. End of use after a sudden withdrawal of a drug, also called withdrawal reactions. Examples: we have adrenal crisis with abrupt withdrawal of corticosteroids. We have rebound hypertension after stopping clonidine. We have withdrawal seizures after abrupt discontinuation of anticonvulsant. Opioid withdrawal syndromes are also example of end of use reaction. We have type F, which is failure of therapy. This is unexpected failure of the intended therapeutic effect. Is an unexpected failure of the intended therapy. It's often due to drug interactions, resistance, or poor adherence, as well as incorrect dosing. And examples: we have antibiotic treatment failure due to bacterial resistance, that is a failure of therapy with an adverse drug reaction. So resistance due to bacterial resistance. We also have oral contraceptive failure caused by enzyme-inducing drugs like rifampicin. We have anticoagulant failure due to drug interactions. So the mechanism of adverse drug reactions, I think we already said quite a number. Exaggeration of a normal physiological action, when the normal physiological action is being exaggerated, or there's immune-mediated hypersensitivity. The body's immune system responds or reacts to these drugs. When there's genetic susceptibility, which means it varies from person to person. Pharmacogenetic factors: we have drug interactions, we have toxic metabolite formation, cumulative toxicity, or idiosyncratic reactions. Now, what are the risk factors of adverse drug reactions? Extremes of ages, neonates and elderly. We have polypharmacy, where somebody is taking too many drugs at a particular time. Some of the drugs might be inhibiting the action of other drugs due to drug-drug interaction. High drug doses can also cause adverse drug reaction. Female sex, they have a higher risk for some adverse drug reactions, maybe due to genetic predisposition or genetic changes. We have renal impairment. It affects the excretion of drug, which might increase the concentration of toxic metabolites. We have hepatic impairment, responsible for metabolizing drugs, and if this does not metabolize drug, toxicity might also increase. Previous history of adverse drug reactions is a risk factor. Genetic variation affecting drug metabolism, multiple comorbidities, as well as pregnancy. So hypersensitivity or allergic drug reactions. Remember we said there are immune responses. Sometimes it will be the immune system that is responding to a particular drug. So this is what we refer to as the hypersensitivity or allergic drug reaction. These are immune mediated and they require a prior sensitization, except in some cross-reactive cases. In most cases, this individual has taken that drug before, and the immune system has been sensitized. After the sensitization, on a second administration of this drug or a second contact with this drug, the body's immune system reacts to this drug. So it is regarded as a hypersensitivity drug reaction and requires a prior sensitization. It is usually not dose related. It has nothing to do with it's usually not related to the dose. Irrespective of the dose, the immune system has been sensitized, so it will react to that drug and result in an allergic reaction. It may recur on a re-exposure to the drug. Common manifestation: we have urticaria, we have angioedema, anaphylaxis, drug fever, skin rashes, bronchospasm. Idiosyncratic drug reactions. This is an unusual and an unexpected reaction. Unusual and unexpected reactions due to genetic or inherited susceptibility. There are some people that are susceptible, genetically susceptible, or they have inherited susceptibility to certain drugs. Though maybe their neighbor will take that drug and nothing happens, but if they take the drug, they will have an adverse drug reaction. It is not related to the drug's known pharmacological action. It is rare and it is not predictable. It's unpredictable. Example, we have hemolysis with primaquine in G6PD, prolonged apnea after taking succinylcholine in pseudocholinesterase deficiency. Some people have deficiency of pseudocholinesterase enzyme or G6PD. They are susceptible to these adverse drug reactions. Malignant hyperthermia in volatile anesthetic. Drug toxicity. Now, drug toxicity, it results from excessive drug concentration or a prolonged exposure. So it may occur due to either an overdose, or it could be due to a reduced elimination of that drug. There could be drug toxicity, or drug interaction, or drug food interaction. Drug interactions might also cause drug toxicity, or an organ dysfunction, maybe an organ that is responsible for metabolizing this drug or excreting the toxic metabolite of this drug. When there is a dysfunction of these organs, this can result in drug toxicity. Examples, we have digoxin toxicity, we have lithium toxicity, we also have acetaminophen or paracetamol hepatotoxicity. Pharmacovigilance. Pharmacovigilance is the science and activities concerned with the detection, assessment, understanding, prevention, and reporting on adverse effects and other drug-related problems. It aims to improve patient safety, detect rare or previously unknown adverse drug reactions, helps to monitor drug safety after marketing, and promote rational use of medicine. So, points you have to remember in exams for adverse drug reactions. You know that adverse drug reactions are harmful. They are unintended responses occurring at normal therapeutic doses. And type A adverse drug reaction, which is the most common, we said it is augmented, it is dose dependent, it is predictable, and it accounts for 80% of adverse drug reaction. For type B reactions, they are bizarre, they are unpredictable, they are not dose dependent, and often immune mediated or genetically determined. For type C, we said it's chronic reaction due to long-term therapy. For type D, we said it is delayed reactions occurring months to years after exposure. For example, neural tube defects after taking thalidomide, or digit defect. We have type E, which is the end of use or withdrawal reactions. We have type F, which is failure of therapy. Now, hypersensitivity reactions, we said they are immune mediated and usually require a prior sensitization. We talked about idiosyncratic reactions, which we said they are genetically determined, they are rare, as well they are also unpredictable. We talk about pharmacovigilance, which we said is very, very essential for detecting, reporting, and preventing adverse drug reactions after drugs are marketed, after drugs have been released into the market. And for elderly patients, children, those with renal or hepatic disease, and patients taking multiple drugs, they have an increased risk of adverse drug reactions. Thank you for watching this video. Don't forget to like, comment, and subscribe to Alacrity Explains Medicine for more interesting medical videos. Thank you.